And a larger baby does not necessarily mean a more complicated birth at all. And so it's part of your informed decision making of how do you feel about this? Baby might be a little bit larger. What would you like to do? And also know that a suspected big baby is not, for a lot of evidence-based research, a valid reason for a medical induction. So that's something else to keep in mind, because as I have been learning in my nursing schooling, that it can sometimes take a while for this evidence-based research to make its way into practice. And so your care providers are simply doing the best they can with the knowledge that they have, but there can be more up-to-date evidence-based research that has come out and hasn't made its way into being in practice yet, which makes it super, super important for people to be aware of all of their options and all of the evidence-based research available around everything in health, but in this case, pregnancy, birth, and postpartum, because you can have those conversations with them. Hey, have you heard about this research? And evidence-based birth is a very, very great resource. So another reason why they might suggest inducing labor is baby could also seem a bit small. And what they would wonder then instead is if baby is getting adequate nutrition from the placenta. Or baby could just be an average size, but your doctor might say, well, if you go past your due date, then we worry about baby getting adequate nutrition from the placenta. And that's just one opinion that some doctors have. Many other care providers have different opinions, including the opinion that there's usually no risk, especially if it's before 42 weeks, because you're not considered late. I know people use that word a lot when it comes to due dates. You're not late until you're past 42 weeks. So after 37 weeks of pregnancy, you're not considered early. You're considered early term. So you're still under the umbrella of having an at-term pregnancy, but you're on the earlier side of it. And then after you pass 40 weeks, you're still under the umbrella of being at term in your pregnancy, but you're just a little bit post-term, but you're not actually late until after 42 weeks. So that's why most care providers understand that there is no medical reason to induce labor until 42 weeks of pregnancy. So just things to talk to your care providers about. And there could be other medical reasons why they would recommend induction, in which case you would talk to your care provider about your specific health situation and what that means for you and what your options are. And then what are the risks? So with induction, the risks are your body isn't ready to go into labor. There is a specific physiological process that happens when baby matures in the womb. And so your baby isn't a loaf of bread, and it can take baby longer or earlier than the average pregnancy in order to be ready. And when baby is ready, they release certain hormones from their pituitary gland in their brain. And that release of hormones triggers a response in your body. So your body picks up on those hormones and says, oh, baby's ready. Baby gave me the signal. Let's start labor now. And so the risk of inducing labor is that that signal hasn't happened yet. Baby might not be ready. Your body might not be ready. And so you are interrupting the natural physiological process in your body. But sometimes it's not a bad thing to have a little bit of help, either from natural or medical induction methods, if it seems right for your situation, your body, and your preferences. And what are the alternatives? You could talk about waiting, perhaps. Depending on what you want, you could try some natural methods first and see if they work, and then talk about having a date or a time where you would reassess. What does your intuition say? Do you feel good about this option? If you do, then great. Otherwise, if you're leaning more towards something else, talk more about your alternatives. And this is a really big one. What happens if I say no or not right now? So this is a huge piece because you are asking about having more time, which could even be infinite, because sometimes you don't actually need to make this decision. Your care provider is just suggesting something. And a lot of the time when they're suggesting something because they want to help, it can seem like it's the only option. And so that was one of those big things when we were talking about different birth philosophies and different care providers and different trainings that people have as well that can inform the way that they think of birth. And in the hospital setting, there is much more of a philosophy of, well, you're here, we may as well, do something for you. We have these tools, we may as well help you. We may as well kind of make this more efficient. And that is a normal way of thinking for health concerns, anything else that brings people to the hospital. But again, birth is something super unique where it's a normal physiological process. And most of the time, there aren't big complications that require life-saving interventions. And so you can use interventions to help change the natural course of how it's going, if that's what you want. But there are usually more than one ways of doing something like that. And one of those things is you can say no or not right now. And excuse yourself. So whenever your care provider is suggesting any of these interventions we are going to be talking about throughout this course, I really recommend that you take time alone or time with your partner to talk about it. And that way you're not feeling pressured to go with what your care provider wants you to do, because remember, they are there for you and they might have opinions, but their opinion, even though it is, extremely valuable and they have gone through so much school, whether it's a midwife or doctor, but their opinion isn't the only one, usually isn't the only option available when it comes to pregnancy and labor. And so you can excuse yourself, think about the options that your care provider helped brainstorm with you, talk to your partner about it or think alone about it, and get in tune with what feels right for you, and then decide.